So I'm John Penn, Director of Volunteer Services at Skyridge Medical Center. Really everything we try to do is try to enhance the patient experience here. And this is a program we've been doing for 2-3 years now, and just the feedback has been so fantastic, so well received.
People's faces light up right away. They kind of forget where they are for a minute and what's going on with them health-wise, and they focus on how the dog is just making them feel safe, secure, calm. And I've even had people say to me, now I can face the doctor, now I can hear what the doctor has to tell me.
My dog sleeps with me every night.
Our patients love when the dogs come in. It takes their mind off that maybe they might be having surgery soon, or they're maybe a little bit in pain. You can see their faces light up when the dogs come in. Plus, it's a wonderful opportunity for our nurses who are so much about caregiving that they can at least talk to the dogs too, pet the dogs. They bring a wonderful smile to the faces of our staff as well as our patients.
A lot of times in my life, I didn't let anybody get close to me. It just did not do that, you know. There's certain emotions that I try to stay away from. And Rosie sure brought them up. We'd sit up here on the porch and just sit there, and the caseworker and the owner and myself and Rosie would just sit there and talk and pet Rosie or whatever, you know. I guess it's easier to talk to an animal than a person. Yeah, she was a big help.
Volunteers will come here usually once a week and visit with 1 or 2 children, and they read, spend time with the child. Most of the time they're struggling readers, struggling academically, or have developmental issues. With some of our more moderate needs kids, the child really forgets that we're in the room with the dog, and they actually begin to read to the dog, and that's why our responses are usually geared from the dog's point of view.
Oh, look at this one. The big head and lower body. That's funny.
And they really do buy into the fact that the dog is listening, paying attention to the story, and the dog is perfectly happy with the way they're reading. No commentary, no corrections, no criticisms. So I think that's a big factor there, and that unconditional love is something that you can't measure with a ruler, but you can tell in the child's reaction that it makes a difference.
It's been amazing to see that we have some kids who just don't respond well to treatment or to therapy, and then we put them in this environment with the dogs and they're able to open up. They learn so much more, and they really make a lot of progress.
I've learned a lot of patience. I learned a lot of just how to work with everybody and how to control my anger.
A lot of the youth are very hesitant to do what they think therapy is or what they think treatment is, and so bringing in the dogs is really helpful for a lot of them.
Before, when I first met Daisy, I didn't talk really. I talked a little bit, but not as much as I do now. But now if Katy asks me a question, I say what I feel and how I feel about it. I was just angry at the world, and then I came and I met with Daisy, and I was happy to do. So I know that
working with the animals and the pet partners really helps them work on those relationship skills and build healthy social skills and build those kind of skills that they need to be able to be successful when they return to the community.
Daisy, bow. Good girl. I really appreciate Miss Carol and Daisy coming out here every week. You know, they don't have to, but they do. So that shows that they care about people in here. Come on. Good girl, Daisy.